Good morning, it's Dr. Garrett, and today I want to talk to you a little bit about sinus infections. So during this time of year and in early spring, we see an influx of patients with quote-unquote sinus infections. So I wanted to give you some little facts about sinus infections. Now, when we say infection can mean a variety of different things. It could be a bacteria, which typically requires antibiotics. It could be a virus, which typically requires supportive care, or it could be a fungus, which fungal infections typically need an antifungal. Now, of these different infections, a sinus infection is most likely viral. Up to 80% of sinus infections are viral infections, meaning that antibiotics don't do a whole lot. Now, some people say, well, every time I have a sinus infection, I get an antibiotic and I feel better. Well, that could be a couple different reasons. One, a lot of antibiotics are anti-inflammatory, meaning they decrease inflammation as part of their process. So if you've got some inflammation going on in your sinuses and we give you an anti-inflammatory antibiotic, it's going to help with that pain and that pressure. And then just good old sweet time. So the sinuses. We have several different sinuses. We have the maxillary, which are in our cheeks, which tend to cause teeth pain if you get pressure within there. We have some sphenoidal and ethmoidal sinus cavities as well. We also have the frontal sinus cavity, which is up here in the forehead. And a lot of times that one will cause a lot of headaches if that one has inflammation to it. Now, as a point of reference, children don't develop sinus cavities till about the ages of 9 through 11. So it's very uncommon for a child to have a sinus infection. Most likely what we see with children is they have a little bit of what we call an upper respiratory infection. It typically migrates out to their ears, so that's why they're more likely to have ear infections. And of course, it'll come out their nose, and sometimes it'll even come out their eyes. So back to adults. How do you know if you have a viral or bacterial infection? Like I said, a good percentage of these are viral, meaning they just need supportive care. However, if it has lasted longer than a week, if you're getting worsening fevers, more headaches, more pressure, or now starting to see some blood in some of that mucus, then that could be a sign of a bacterial infection that may require the use of antibiotics. Now, typically the antibiotics we're using are something that would cover both staph or strep. And then, of course, we have some atypicals. Usually it's like amoxicillin, augmentin, or a Z-Pak that we're using to get rid of these sinus infections if we deem that they are bacterial. Now, how do these work in the body? Typically, their method of action is that they break down the cell wall of the bacteria and cause it to die. So some of these are not respecters of what type of bacteria is in the body. So when you take these will clear out lots of bacteria, including what we need in our gut to keep our gut nice and healthy. So a lot of times you'll see side effects of diarrhea or nausea because it's removing that good symbiotic bacteria from our gut. And it can create a state of dysbiosis, which can cause more problems down the road. So what do you do if it's viral or even supportive care for bacterial infections? One, drink your water. Keep those secretions nice and thin. Breathe in some steam. Steam is very good. If you're getting a sore throat, then hot tea and honey is a great option for you. Anything with salt in it will make your throat feel better. So chicken noodle soups, Gatorade, saltwater gargles. And, make sure that you're taking your vitamins. Make sure you're getting plenty of vitamin C. Make sure you're getting plenty of zinc. That will help kind of beat this off as well. Now, in terms of taking Tylenol and ibuprofen, you absolutely can. Ibuprofen would be a better choice because it's an anti-inflammatory. So it decreases the inflammation within those sinus cavities. Things that'll make sinusitis worse would be milk products or dairy products. They tend to be a pro-mucolytic, meaning that they will cause more mucus. So laying off the dairy for a couple days if you have what you think is a sinus infection. And then drinking stuff that has bromelain in it, so pineapple juice or eating pineapple, will help decrease some of that mucus within those respiratory tracts and make you feel better. Now, if you have any questions, give us a call, 812-290-2128.